Okay, so hi everyone. Today we are back with a new topic, that is evaluation and comparative of anti-arthritic activities of banana leaves in rats. So here I will explain this topic in brief. So let's get to the next slide. So as you all can see in the screen that rheumatoid means rheumatism, which is a phenomena of musculoskeletal illness, and arthritis means it's subdivided into arthur means joint and itis means inflammation. So rheumatoid arthritis is an autoimmune disease which is caused by chronic inflammatory disorders and which can also affect other organ systems like skin and lungs. So here is an example of synovial joint, in which you can see here is like this is the bone, this is the synovial cavity, this is the synovial membrane, this is lymphats, this is the blood vessels, the blood cage, this is the articular cartilage which protect the bone membrane, which is made up of connective tissues and work as a protective cushion for the bone. And here is the synovial fluid that produces debris. Debris means waste material of any cavity. Okay, so it is connected with fibrous joint capsule. So here is the simple anatomy of any synovial joint. You can also say it as a knee joint. So moving forward, we'll understand how arthritis gets started and what is the path of bone destructions. So when the T cells secretes cytokines, these cytokines contain interferon Y and interferon leukin 17. Okay, so there what happens is it recruits macrophages. Macrophages means what? Which are used to produce more cytokines. As you can see here, like these are the examples where it makes an complex, right? So there is a complex of TNF alpha, interleukin 6. Okay, so here you can see that in this structure pannus is formed. Pannus is what? Pannus is nothing but the swelling of that fibrous joint capsule. So how it is made up? It is made up of granulation tissues like fibrinoblast, immunoinflammatory cells, microfibronoblast. Okay, so when this immune complex made, it releases complementary system. Complementary system means 9 small proteins enzymatic cascade, and that result in joint inflammation and injury. If it is not cured, if it is not treated, then it can result into the chronic inflammation, which is also called as angiogenesis. This is called as phenomena of angiogenesis, in which the new blood vessels get more inflammatory cells respondent. So as a disease progress, multiple joints, both sides inflamed and gradually destroyed the bone. Okay. So how you can treat it? You can treat it by disease modifying agents like we have methotrexate, sulfasalazine, hydrochloroquine. These are suppressing inflammations. The other factors we have like biological response modifiers, in which have retizumab, adalimumab, etc. These also work as tumor necrosis factors. Okay, and the last one is acute flares, which work as NSAIDs or glucocorticoids, anti-inflammatory. Results as a short-term treatment. So we are also planning for parameters like in vivo and in vitro parameters. In vivo simply means which is done on a living body, And in vitro means we are working outside the body. It means we are getting tissue out for the sample, and we take the whatever process, quantitative or qualitative estimations. So in vivo parameters, we have decided to work on pore volume, body weight, arthritis score, MPO, hemoglobin level test, erythrocyte sedimentation, thymus spleen, and histology of joint, lungs, liver, kidney, and radiography. We also have CRP test for in vivo. For in vitro, we are planning for protein denaturations by using bovine serum albumin, egg albumin, and we are also planning for human red blood cells membrane stabilizations. So these will the parameters where we do a comparative study between the sulfasalazine and the Banaba. The Banaba, which is an also called Legrostromin speciosa, and we are taking sulfasalazine as an standard drug for the treatment. So we'll compare both the drugs with Banaba as 400 mg per kg treatment, first group, and second group we are planning for 600 mg per kg. So let's see what the results with the statics comes. We'll share with the next slides or in a next video. Thanks for your time and keep watching, and please like and subscribe for this great and wonderful experience. Have a good day.